United States, access to healthcare is not a right, it is a privilege. For Black Americans, this privilege has been historically denied, leading to significant healthcare disparities. In this episode, we will explore the issues of healthcare access and delivery services in Black communities, including disparities within healthcare insurance. For Black people, systemic racism and social determinants of health have resulted in unequal access to quality healthcare, healthy foods, safe living environments, as well as adequate education. These factors have contributed significant impact to health outcomes of Black people.
Oftentimes we want to start with the government study in Tuskegee. So number one, let's make sure that the government is also accountable. This wasn't the Tuskegee syphilis experiment. This was the government syphilis experiment that just so happened to take place in Tuskegee. But we can go back to slavery and see even women that were a part of research studies without their consent. Extreme trauma. I think about the man that was known as the father of gynecology and the type of research that he did on Black women that were slaves who couldn't say, "Stop mutilating my body," and all in the name of science that benefit women who didn't look like them. We think back even in recent years about the Mississippi appendectomy, where we had, this is Mississippi's model to control the Black race. So every woman of childbearing age that went into a hospital received a hysterectomy. And when you think about one of the greatest civil rights activists, such as Fannie Lou Hamer, was not exempt from the Mississippi appendectomy. This country has given Black people a reason to mistrust the medical system.
Historically, we've seen where other communities have been prioritized despite Black and brown folks bearing the brunt of the diseases. And we've also seen where, in the case of COVID-19, for example, right? A lot of Black and brown folks were also very distrusting of the vaccine because of the speed at which it was produced, not to mention the fact that we live in a country where there have been so many atrocities that have happened historically when it comes to Black and brown folks and interactions with healthcare authorities. A lot of times people have been misled. You find that people feel like they're divorced from the conversation, right? Because here they are being the persons that are most affected, yet they're not necessarily a part of the conversation when it comes to what healthcare should look like, what are healthcare options, transparency when it comes to explaining how things work, what are some of the side effects, and can we really believe in this thing? So a lot of people, when you compare, for example, COVID to Mpox, right? A lot of people were very, very apprehensive about, getting a COVID-19 vaccine, whereas in Mpox, there were a lot of different motivations that allowed Black and brown folks to really get access. The first being that COVID had already re-highlighted and rehashed the racial disparities when it came to healthcare.
We must address the root causes of social determinants of health to achieve health equity for Black people. This means advocating for policies and programs that address economic stability, access to healthcare, housing, education, as well as community safety. It means dismantling systems of oppression and discrimination that contribute to health disparity.
What does it mean that there are more liquor stores in my neighborhood than health clinics? What does it mean that when I go to the doctor's office and I say that I have a degree of pain, that is not responded to meaningfully? Or that when the doctor, the physician, communicates something to me that they don't ask if I understand what's being said. I think one of the limitations of the social determinants of health is that there are structural, there are political, there are nuances to this thing called racism. And because of that, I think there's a way to do social determinants of health work without a social justice or a racial lens, which perpetuates the issues that we're describing.
I have the privilege of having health insurance, so I really haven't had too many struggles getting care. Last year was a very unique experience for me. That was the first year I felt like something's not right as far as me struggling navigating care to receive some supportive services as it relates to MPOX. It was like a different experience. It was almost like, it reminded me of back in the day how people would share that they were living with HIV and people were like, oh, I don't want to be here anymore. That's what I experienced. Fear, stigma, being mistreated, overlooked. I felt all of that from the medical community. I felt like it was about that provider, not about me. Like they didn't want to touch me. Let me show you what it's like, oh, okay, I see it. Cover up now. That's a bad feeling.
Black Americans face significant barriers in accessing healthcare, including lack of insurance coverage, transportation, and language barriers. These barriers can prevent individuals from receiving the care that they need.
When you see policies that are focused on specific populations that impact the health outcomes of those communities, that's a problem, right? And so let's own that. As we've seen a case previously about the HIV prevention strategy known to many of us as PrEP, pre-exposure prophylaxis, that a judge in Texas rules that the insurance companies don't have to cover this prevention strategy based on a company's religious beliefs. The word that they specifically used was homosexual. And I thought to myself, one, how ignorant of the judge, not realizing that heterosexual people as well access this HIV prevention service. So it's clear to me the discrimination and the political discriminatory practices against gay people, and for our purposes, how it impacts both Black gay men and Black people of trans experience.
And we were seeing so many disparities that were happening with Black and brown folks. We were seeing issues with the justice system here in America, where people were being singled out, being targeted, and Black and brown folks were losing their lives at a disproportionate rate in comparison to our counterparts. The initial demographics were showing that there were a lot of Caucasian people and non-POCs who were actually getting access to the vaccine immediately. There were some people that I knew that were getting it through private providers, and I'm like, how are you getting this? Like, is this a thing that's already released? But people were getting access to the vaccine, and Black and brown folks who were the people who bore the brunt of the disease were being, pushed aside, and there were a lot of people that were like, no. This does not look okay. This is not right. There were a lot of people who spoke up about it. And so that's how that collaboration with the CBOs was born, in order to ensure that Black and brown folks were, at the front of the line instead of at the back.
I think everything in this country should be approached from an equity lens. And I think everything connected to our health and our wellness should be approached from a health equity lens. Everything.
Our call to action is a simple one. Demand equitable access to healthcare for all, support initiatives that promote community-led healthcare solutions, and hold our elected officials accountable for creating policies that address healthcare disparities.